3, 2. Assalamu alaikum and good afternoon, everyone. Welcome to the Prime Healthcare Group webinars on further education. It's a continuous process that we have where we are trying to incorporate ourselves with the society and come up with topics every week almost. We have a panel of doctors with us who will be joining and discussing some very important topics today. Before I move on to my speakers, my doctors, I would just like to inform you that this talk today is based on the World First Aid Day, which we had a couple of weeks ago. The whole month we were celebrating that. First aid is the most important part in any healthcare system, be it hospital setups, be it clinics, or be it homes or malls or any other place where humans exist, because there are certain conditions and signs and symptoms and scenarios which can come up at any point. And our specialist today will try and give you some pearls and discuss with you and give you will give you these clear picture of how to handle these cases. It does not necessarily mean that you do a full treatment. Again, first aid is the part of action, the treatment which is given until a complete medical system arrives. So these are the initial phases which can be life-saving. Today we are very fortunate because we have a group of doctors. They are basically the jack of all trades. They have been working in a primary care system where they've been exposed to a lot of cases. They have seen a lot of different populations. They work with different age groups. We have family physicians with us today, joining us. I would like to introduce my panel members today. To begin with, we have Dr. Sabah Khalid. She is a family medicine specialist. She works with Prime Healthcare Group. She's situated at another branch. She has been in practice for a while, and she has a very high clientele, and a lot of families they routinely follow her as her primary care physician. We have Dr. Jeffrey Zakaria, who has been with Prime Healthcare Group as well for a while. He has a very dynamic personality, very efficient. His patients really love him. He's been in family practice. He deals with all sorts of cases in primary care setup, and we welcome him to the program. Last but not the least, we have Dr. Kritika Rani with us, who is situated at the Berjuman branch. She's been a family practitioner for a while. She has a very good clientele. Patients are very fond of her. The way she interacts, her diagnostics are very accurate. All in all, we have a very good team, and we're very fortunate to welcome all of you today. Good afternoon, everyone.
Good afternoon.
Good afternoon.
Good afternoon.
Right. Moving on. First Aid Day basically was a day which was celebrated, or in other words, it was established to create awareness in the common population. Now, when you talk about first aid, it does not mean the patient has already been in the hospital. We are basically talking about those scenarios where a lot of common people will in day-to-day life at different points in different places come across certain scenarios where some medical assistance is required immediately, and these interventions can prove can actually save life and prove very beneficial for the patient once he's sent to a full care setup. So we have a lot of common complaints that we chose. We went through a list, and we will try to answer questions if you have any questions while you are online with our panel members. I will begin with a very common symptom. As everyone is aware, the most scariest and the most important symptom or chief complaint of any person at any point of time, including houses or malls, or you probably are driving and you have a friend with you, is chest pain. For chest pain, I would actually ask Dr. Kritika if you can just shed some light about the types of chest pain. What is the common presentations of these type of chest pains, and if someone encounters a situation where you have a next door person or someone in front of you complaining of pain, how do you approach these patients? What is the most important initial steps that we take as first aid in these cases, Doctor?
Okay, initially I would say the first aid is given by a bystander who has very minimal or no knowledge of medical conditions. So if you see a person with chest pain, It could mean anything actually. The most scariest of the chest pains is the heart attack, as you all know, which is called myocardial infarction. Uh, in this, there are different types of chest pain in which this is the most dangerous one. And in this case, the person complains of a very heavy sensation in the middle of the chest, and he might be sweating, or he might have the pain going to the jaw, to the hand, the left hand or the right hand, or anywhere in the back or the side. Which, if that is the case, then and you need to alert the ambulance first, which is very important in any first aid, and then see if he has any previous history of chest pain. Like if he's telling he has aspirin with him, if you have aspirin tablet, which is called the baby aspirin, you can just give him that, and first ask him to relax and avoid stress, and take deep breaths. And in the meantime, you call the ambulance and check for the just give. Suppose he has a tablet called glycerol trinitrate with him, you can give a puff of that also, and wait till the ambulance comes. There are various other chest pains also which are not so serious, like something called gastroesophageal reflux, like acid reflux in the chest, which also presents similarly. But the patient may tell about a burning chest pain, and he feels something coming out in the throat. So, and there are other conditions like a muscle pain, which is very common, especially when the weather is changing, especially in early morning. The patient complains of severe chest pain. So, if you are in doubt about the chest pain, it's always best to call the ambulance and go forward. They told you to take the aspirin or GTN spray with.
Dr. Kritika, how important is the intensity of chest pain? Does every heart attack, let's use a common term, which is heart attack, does every heart attack mean the patient will tell you that he's in severe chest pain?
Sometimes there are patients with certain conditions like diabetes where they don't perceive the pain as severe as a heart attack. And some women, it's not a typical presentation of a central chest pain when it is a heart attack. They would rather complain of an upper abdominal pain, or sometimes they could have palpitations or giddiness, or pain at the back, or pain in the throat or the jaw, which is very atypical. But still, we need to rule out a heart attack, and they might not have the same intensity as that of a other person with where these conditions are not there, like diabetes. And for our elderly people also, they don't complain of a typical chest pain. They might just complain of a very mild chest discomfort, which also needs to be taken seriously. And yeah, so these.
So as an expert, you advise all our viewers today that if someone presents to you besides you, and if you look at their face and they're sweating and they're in agony, if they tell you that they are having severe pain and they're not able to breathe, the best thing to do is to call the ambulance, and as you mentioned, if they have aspirin, to give them aspirin and stuff.
Yeah.
Great,
The more
great.
aspirin if it's available, or glycerol trinitrate if the patient already has a spray at home.
Right. How important is time factor, Dr. Kritika, in these cases? How serious should we take this symptom?
Actually, it is very important to alert the ambulance immediately when you know it's a heart attack, like the symptoms from which I told you now. If you know it's a heart attack, it's very important that you immediately alert the emergency response system, because the patient might look normal now and suddenly he might collapse and become unconscious. So in that case, we need to start something called cardiopulmonary resuscitation, in which you just have to make him lie down and just try to press on his chest, because I'm sure most of them know how to do the compressions, start the chest compressions.
Of course.
Yeah.
Of course, thank you. Absolutely, absolutely. I think this was a very important point that you mentioned, to make him lie flat, and if there is no pulse, to start CPR immediately, because there is a lot of studies, pre-hospital studies, there's a lot of evidence, there's a lot of research that pre-hospital set up a patient collapsing, especially complaining of chest pain, and early CPR. So thank you, that was a very good point, and I hope that everyone remembers this. And of course, in any situation, to call 999 right away, and then let the paramedics arrive. Until then, a common man can just be beside the patient and make sure he's available there.
Yeah.
Thank you. Thank you. Moving on, another common condition, this is encountered at home. We all have adults, we all have old people at home, parents, grandparents. One of the common symptoms which require first aid is someone who is drowsy. You walk into your parents' room or your grandparents' room, you pass on and you stay there, and when you try talking to them, the patient sounds a little slurry, the speech is not right, and you see that the patient is probably drooling from his mouth or not able to move his limbs. So my question to Dr. Sabah here, how would we identify what would be the red flags in patients like these, and what should we be worried about in such cases, and how do we respond to such cases, Dr. Sabah?
Thank you, Dr. Mohammed. It's a good question, and I think we come across many cases like this, and which, like elderly patients specifically, the aging patients which are at home, we found drowsiness. See, at our age advances, there are multiple comorbidities which are going along with the patient. So the family knows better what is going on with the patients. The most common conditions is with the diabetes. So diabetes is one thing in which our body is, not making enough insulin to metabolize the glucose. So first condition, they will immediately, which comes to their mind if they are diabetic, whether they are hypoglycemic or they are hyperglycemic. But hypoglycemic is their sugars are getting down. Okay, specifically the patient is on insulin, and if he has taken the dose more in amount, or mainly if the patient has skipped the meals, or the patient has overexerted. So hypoglycemia is the one condition which they have to rule out. And second is hyperglycemia, because both of the symptoms are overlapping. You cannot make it out whether it is high glucose and sugar. Only the thing which is differentiating is that in hyperglycemia, the onset is very slow. Patient will be drowsy for 1 or 2 days. But for the hypoglycemia, it is all of a sudden. Patient will go in the drowsiness all of a sudden. So if the people doesn't know whether it is hyper or hypo, choose for the hypo first. Give to the glucose tablets, 15 to 20 if you have the glucose tablets. If you don't have glucose, never mind. Just put 3 tablespoons of sugar into the water. And if patient is still alert, give the sips of water to them, okay, so that the consciousness regain. And patient will be okay within the 10 minutes. If the patient is not getting better, call them. Okay. If in case of hyperglycemia and you have the glucometer with you and it's giving high glucometer readings, so call your doctor immediately or just check whether patients have missed the dose or anything. Now coming towards the another point also, that if in case, because in elderly patients sometimes there can be electrolyte imbalance also. We never know, because in elderly patients sometimes the salt depletion or low sodium levels are one of the main causes. So for this reason you have to go for and check for the emergency services. Then third cause, one of the causes is epilepsy. Most of the patient of the epilepsy, in which what is epilepsy is like a fits in our journal terms. Fits is caused by the disruption of the brain system. Your neuronal activity is not proper. Some people have primary fits from the beginning, they know their condition, but some people have secondary to other causes. For example, it can be secondary to fever, to any head injury, it can be metabolic cause like disturbance in their electrolyte system. So there can be any in later in life also. It's not from the congenital or from the birth. In children, yes, it's more of the febrile type of fits, like which is associated with the fever, especially the 6 years of age. So we have to see the sign and symptoms. It will be a sudden loss of consciousness, sudden collapse of the patient, especially the jerky movement, the stiffness of the jaw, then noisy breathing can be there, then with the saliva, the drooling of saliva from the mouth. So look into this, how the patient is reacting. Is there any jerky movement or anything? In that condition, always keep the patient on the floor. See their surrounding. There is no anything which can cause the injury or harm to the patient. Give some support to the head side of cushioning to the head side of the patient. Okay, keep in onto the one of lateral position or roll up the patient so that the tongue will not fall down and it will block the airway. Okay, and just make sure that that patient clothing should be light. It should be little, make it loose in it. Okay, note the time of use. If it is going in within 5 to 10 minutes, it's okay. If it is patient is not recovering after the 5 minutes, because maximum is 5 minutes. If patient is not recovering in the 5 minutes, call the ambulance. Or if it is a first fit, call the ambulance. If the patient is stranger, you don't know about the history, call the ambulance. Do not insert any fingers or anything inside the mouth. People try to open the jaws. That is very wrong, actually, practice, because it is already. Don't try to give the water or something. Once fit is over, it will be all right itself. And he will take he will go into the deep sleep, might be, but that is the relaxation phase of the epilepsy. So just see for this one. God forbid if patient is unconscious or patient is not coming back, reverting back. If you know the CPR, start for the CPR. In the meantime, ask for the help so the help will come, and you can start the proper procedure.
Great. Thank you. No, you've said it all, and you've said there's a lot of important points, especially the part you said that it is always to consider a patient hypoglycemic than hyperglycemic, and early administration of honey or sugar is the most important action as a first aider. So I hope everyone remembers that, as Dr. Sabah has just mentioned, that a history of diabetes with the patient being flaccid and unresponsive, drowsy, tired, not responding, not talking, while he's just opening his eyes, it's always good to give him some sugar to make sure he's not in a state of hypoglycemia as the brain works on glucose. And another point that Dr. Sabah, thank you for mentioning the point that we have to roll over the patient, because we notice that a lot of times that the bystanders or we just notice and we witness an incident, especially someone with fits, and a lot of people are scared to approach these patients. So again, this is a very valid point, and I hope everyone takes home this message that as soon as we see these patients, we always move them to the left, or as she rightfully said, we can turn them over so the tongue doesn't block. And thank you very much. These are very important points, because as you mentioned, if you have no history about a bystander, we can't start treating them or assuming things about their health. The best thing to do in these cases as a lifesaver, first aider, is to call 999. Thank you very much for that answer, Dr. Sabah. Moving on, Dr. Jeffrey, I have seen this happening many times, and this is something very common. There are two types of patients that develop allergies primarily at home setting. Either it is a reaction from something very significant, like they ingest peanuts, or there are contents of peanuts in some food, or seafood. Basically, allergic reactions at home. A child or a patient just starts developing some sort of uneasiness after ingestion. So what is your take on that, Dr. Jeffrey, about these allergic reactions related to food? Anaphylaxis. Dr. Jeffrey, can you hear me?
Sorry about that. Dr. Hamid, thank you for the question. In allergic reaction, we have two types of reactions. So we have the severe types of reactions, which we call the anaphylactic reactions. And then we have the mild to moderate ones, with just wheals or redness and rashes on the skin. Now, peanut allergy particularly is mostly an anaphylactic type of reaction. So there are a lot of children and adults who are severely allergic to peanuts. That's even the tiniest portion of peanuts. So if there is even a very small grams of peanuts even in the food, patients exhibit large symptoms. There is symptoms of whether they feel like suddenly the chest is closing up. They first of all start breathing rapidly. They find their chest closing up, and they feel like they're palpitating. Their chest, the heart is going faster. The beats are faster. They're sweating. And then suddenly there's a syncopal attack. So the child or the patient faints. Now, these are very urgent and a very important situation that you need to recognize. The moment you realize that the child or the patient is having anaphylaxis, the first thing you need to do is, if you are a relative of the patient, or if you're a bystander that knows the patient and that the child or this patient has an allergy, look around for an EpiPen, because these patients do have some amount of, they usually carry an EpiPen along with them, and try to use an EpiPen. So for those who don't know how to use an EpiPen, there's a very easy way to do is blue to the sky, blue to the sky and orange to the thigh. So that's usually how we usually use the EpiPens. So the orange side of the EpiPen is shot to the thigh, and the patient gets a dose of medication. So that would revive the patient. That would actually revive the patient. But then one of the most important things that to remember when you have anaphylaxis is to call for help. Don't panic, call for help, because the patient needs to be taken immediately to the hospital and needs to be given first aid at the hospital levels. Now, if at all it was mild reactions, you have slight allergies, slight reactions to the skin, you find yourself a little red, a little flushed up. These can happen with other types of food, with certain types of seafoods. You go to a restaurant and have some shrimps. You develop some of these. Some of the patients do develop these. If you don't think of the allergies too much, it's just a little bit of itch here and there, you can always take some antihistamines. Some calamine lotions to soothe the skin, antihistamines like cetirizine or fexofenadine, that's like Telfast. You can use any of these medications to bring down these allergies, and that should definitely subside.
Great, thank you. That was very elaborative and very clear. Dr. Jeffrey, one question: how easy is it to acquire an EpiPen? What is the procedure? Because we have people right now, they're listening to us, and they've heard of EpiPens, but now that you've mentioned it, that this is a life-saving drug and it's easy to use, blues the sky, shot on the thigh, so it's quite easy. And I'm sure people are so updated now that they can always look at the videos and learn these procedures. But if someone needs to acquire an EpiPen, what is the procedure? How do they get hold of it?
Well, some of the pharmacies do provide EpiPens. So it's not. I don't think it's available with all pharmacies, but certain large pharmacies do have EpiPens, and you can probably reach out to them and ask for an EpiPen. They should definitely have it.
Right, and if not, then they can always visit any of you guys and explain their conditions, and after thorough examination, I'm sure they will be able to get a prescription for that.
Of course.
Great. Thank you very much. You mentioned people see seafood reactions happening mostly at restaurants, which is a funny thing. It does actually. So in restaurants, there's another scenario which a lot of us have seen, which is choking. People, especially having steak or a lot of red meat, end up swallowing the food, and they suddenly start, they get into distress. So Dr. Kritika, I would like to ask you, what are the early signs? How would you approach such a scenario if I was a layman and in a restaurant and I saw someone in this state? What is your take? How do I approach it? What should I look for, and how do I deal with this scenario?
Actually, such a situation needs a high degree of suspicion. Actually, when you're sitting and you see someone who's making signs like can't breathe, can't swallow, can't talk, then probably he's choking. You just need to approach him quickly and ask, "Are you choking?" He might not be able to answer you, but he might just nod his head saying yes. In that case, what you must do is immediately go and stand behind the guy and just put your hand around his abdomen, between the navel and the breastbone. Make a fist with one hand like this, and grasp the other hand like this from the back side. Use thrust. Thrust his tummy inside and upwards, and make him bend over so that all the any food particle in the throat would come out because of the increased pressure on the abdomen. So keep on doing the thrust till the foreign plate is expelled outside. Sometimes it may not come, and the patient can become unconscious also. When he becomes unconscious, you make him lie down immediately and start your CPR. But make sure you inform someone to call the ambulance, because he would need an ambulance to take him to the hospital. Sometimes there could be a choking which can be milder than this. Like this, the patient would be coughing and hear some noise in the chest. We need not do anything about it. The patient actually would just cough it out, and we just have to encourage him to cough and bring out the foreign body. So if the patient is a small child, and you can just behind him and just on his abdomen and try to push the foreign body outside. You need to kneel behind the child. If it's a baby, just place him in your forearm and try to give back blows like this, the head facing down, and try to expel the foreign body. But very important is to inform the ambulance before we proceed to this actually, because these are life-saving techniques to bring out the foreign object outside.
Absolutely. Dr. Kritika, question. A bystander is a 45 kg female. She can barely lift someone up. And the technique of going to the back and the patient, the person who's choking is probably like 70, 80, 90 kgs. So instead of going behind him, is there any other method where she can apply the same thrust while she doesn't have to lift him up?
Yeah, we can just stand behind the patient and just press on the chest and push the foreign object outside. Basically, the principle is, it's called Heimlich maneuver, in which we increase the pressure in the chest or the abdomen so that the foreign body is expelled outside easily. The main thing is that it has to bend forward, otherwise it doesn't come out actually. It would come out because of gravity and increased pressure. Basically, you just
Right. We have a question here from one of the viewers. They said they read somewhere and they probably saw it in a show where they asked the person to lay flat on the ground, and then they came on top and started doing it from the front while he was on the ground because the patient was morbidly obese, extremely fat. Does that work as well? Can that be applied until the help arrives?
Actually, it's better to make the patient lie down if you can't do anything about it. And you start chest compressions and try to expel the foreign object and try to check the mouth if the object is coming out.
Great. Thank you. I am sure a lot of people will take home this message and at least try to help and rush in and try to do the Heimlich maneuver. Thank you very much for the answer. Common scenario again, outside hospital setups or clinic setups, people just, while they're walking and they just crack their foot or they twist their knee and then they just fall down and then, so my take on common falls and trauma or ankle sprains. Dr. Sabah, would you mind giving us a few tips on how to handle such cases?
Thank you, Dr. Mohammed. Actually, some patients ask about what is sprain and what is sprain. So basically, both the things are same. A sprain is an injury to the ligamented joint, and strain is the injury to the muscle. So many times people are confused. For example, if there is any trauma at home, that is it a strain and a sprain, or it is a fracture? Should we go and visit the doctor? What is the initial thing we should do, whether it is no or it is not a fracture or it is a simple strain or sprain. So I can tell you that only the X-ray is one of the modality who can tell you clearly, because sometimes hairline fractures can present as strain and sprain. So better thing is to go and visit the doctor. Now,
The first thing, I approach someone with his leg, do I have to do any maneuvers or do I just leave it? Do I need to apply something?
That one, I'll come to that point. But first, the sign and symptoms, what it can be, the pain and tenderness and all these things, it will be a natural, you will see a bit of deformity in the skin also, or sometimes it is mobile. So try not to change the position of the patient. For example, so first thing what you have to do is reassure the patient and tell him not to move. Okay, then what you can use your hand to keep the injury still until unless some medical help arrive and it will be immobilized professionally. Do not move the patient from that place until unless mobilization is done. Okay, you cannot move the patient until unless it is at the road traffic side, and you have to then first let it be fixed and then you can move the patient from that side. So always take care of things. Second things, don't try to do the bandage yourself. Okay, if it is an open wound, just with the dry dressing, okay, just try to cover it. Do not give patient to eat or drink anything. He might require surgery. Okay, so don't give anything. What you can do at that time, just rest. If he's the middle of any sports events or anything, tell the patient to rest. Second thing, what you can do is the icing. This is the best thing, which reduce the severity, which reduce the swelling also. But make sure don't do it directly, please. Otherwise, you will cause the frozen bites. Okay, you can make it a barrier or something, or some towel you can use. Okay, to do the icing thing, and do it every 10 minutes. Okay, do it for 10 minutes every 2 hours, and you can do up till 24 hours. Then third thing, what you can do is elevate the limb. Elevate the limb or the injury site. It will reduce the swelling of the injured limb. And you can do the compression, but do not squeeze it. You have to apply a firm compression on it. It will further reduce the swelling.
Thank you. This is the most important point, and I'm sure, I hope people will listen to this part. As you mentioned, do not manipulate and do not move the limbs or the fracture sites, because there are people who have actually injured their nerves, their arteries, their veins because of improper handling. So this was the most important thing which you mentioned, and that is completely true. And thank you for that point, Dr. Sabah. We are receiving a lot of questions. We have a lot of people asking questions from our experts. I will just take one question here, and then we'll move again to our panel. The question is, what do we do in a child who is complaining chest pain? How important is chest pain in children? Dr. Kritika, what is your take on how important, as a lifesaver, as a first aider, should we take this complaint? How serious?
Yeah, we need to, depends on the age of the child. We need to, and when we encounter a child with chest pain, we need to talk to the child if she's having any anxiety at school or any exams coming forward, and what type of chest pain it is. We need to assess the type of chest pain she's having. It's very rare for children to have myocardial, a heart attack or something. It could be just gastritis or gas. We need to check with the parents whether there's any history of any congenital heart disease, which could be a red flag as well. And most of the time it could be gas, and we can try with antacids at home, any common antacids, and just reassure the child. And if the pain is still persistent, we can just take the child to the hospital. Also, we need to find out if during the child, when she was playing or something, someone hurt on her, someone banged, or there was an injury to the chest. We need to find out even that. And then based on the findings, we can proceed accordingly. I can't hear you.
Dr. Kritika, there's one more question here. There's a viewer who's asked, how would you differentiate, just in short, what would be the major sign of differentiation between a true chest pain versus a gastric pain?
It's very difficult to differentiate between both, actually, as a layperson. But what I would say, central crushing chest pain, like some heavy sensation, like a big elephant standing in the middle of the chest, we say, actually, if that is the type of pain, it's mostly due to the heart, actually. The gastric pain is mostly a reflux, like a burning sensation in the chest. But even that can turn out to be like a crushing pain for some people. There's a condition called esophageal spasm, in which the esophagus contracts, and it's very similar to the pain of the heart, actually. So it's very difficult as a layperson to differentiate between both. If in doubt, you can just come to the clinic and we can do an ECG and check the cardiac enzymes and see if any.
Absolutely. Sitting far from this patient, and your comments are very valuable. You're absolutely right. As a layman, he would never know the difference between a true heart attack and a gastric pain. So as Dr. Kritika just mentioned, when in doubt, shout. If you feel that the patient is not looking well, complains of some chest pain that you're not sure about, as she mentioned, you can always go to the experts, let them assess you, let them do the basic management, let them do the ECGs, cardiac markers. So I hope all our viewers will take home this message as well. Doctor,
in fact, we don't see the typical chest pain. Generally, they complain of jaw pain, or we've even seen patients complaining of upper abdominal pain. Like they say, doctor, I have gas, but it turns out to be a heart attack when you do the ECG. So we need to be very careful about the past history of the patient, whether they had any heart problem earlier, or whether it is there any high sugar in the patient and they don't realize they have a chest pain. This aspect is also very important. so that we can further with the management. And ECG is very important in any chest pain or any other pain.
100%, 100%. You're right, Dr. Kritika. This is the most, 100% what you said. This is the most important thing. Thank you for your expert opinion on this chest pain, because this is a symptom taken very lightly, and it can turn out to be very devastating. As you just mentioned, epigastric pain, as you mentioned, jaw pain. I mean, especially if someone has had an issue before and they've had a history of heart attack before. So I hope that people will remember this part. If it's a jaw pain, as Dr. Kritika said, abdominal pain, then please make sure to go to the specialist and let them assess you. Dr. Jeffrey, a common scenario outside hospitals and clinics, again, is insect bites or animal bites. What is your take on bites? How do you manage the wound right away if someone gets a bee sting or any sort of bite?
All right. So when an insect bites you, it usually uses its mouth parts, and when an insect stings you, it usually uses its stinger. Right. So that's something that we need to understand. Most insect bites are not venomous, and the sting, if you have a bee sting or something like that, you have to. The first one of the things that you need to do is try to remove the stinger from your skin. You have to understand there are people who like speaking about anaphylaxis before. There are patients who can have an anaphylactic reactions to bee stings also, and that's also quite important. So you need to know what's the reaction that you have to insect sting. So you might have, certain individuals might have trouble breathing. The voice starts becoming hoarse. They start wheezing, that's listening to a whistling sound. You might find your eyes, your nose, your mouth swelling up. You might even have some crampy abdominal pains, vomiting, diarrhea. You might even feel like you're passing out, or even feeling dizzy. So these are some of these symptoms that you feel when an insect bites or you get a sting there. Now, what do you do when a normal insect, you get a normal sting? So the first thing you need to do is wash the area with soap and water. Cool water, keep the area nice and cool. At the same time, wash it well so that there's no infections that are going to happen. Try not to scratch it, which is quite important. At the same time, apply damp, wet cloth onto the area. And if it is an itchy rash, then might as well use an anti-itch medicine like calamine lotion. Or if you have some pain in the area, you can try using some ibuprofen or paracetamol to relieve the pain.
Thank you.
Yeah.
Yes, please.
Yeah. So these are for the insect stings or bites.
About cat bites?
Well, okay. A lot of them do have pets at home, and cat bites, dog bites, cat scratches is something that we usually see in the clinics. Now, if you have a bite, now again, you must differentiate between a bite and a scratch. So that's quite important. Because if it's a bite, then you might need injections, particularly rabies. You need to get rabies injections if there's a rabies exposure. If it's a scratch, then you might need to do something else about it. But what we basically do is cats usually cause wounds with their teeth or claws, and you need to know what kind of wound you have. So the first thing is the depth of the wound. So if you have a puncture wound because of a bite, or if you have a scratch wound, very superficial scratch wound, then you need to first, like you do for all wounds, you need to clean the area with soap and water. The first thing you need to do. Now, do remember that scratches and bites does require vaccinations, or you need to immunize yourself from rabies if it is a bite, or you might need, that's particularly if it's a stray bite. If it's a vaccinated animal, then you really don't need to. You probably just need to get yourself examined by your doctor. But if it is a slight scratch, then you probably might need a tetanus toxoid injections, provided you've not taken your vaccine for the last 5 years, or you don't remember when you had taken your last dose.
Great. Just wanted to remind the viewers who joined us late, as Dr. Jeffrey mentioned, how to take care of the wound, what are the steps to be taken. But at the same time, we'd just like to remind you that anti-rabies vaccines are only available in government setups. So if you are in doubt and if the dog is rabid or if you are not aware of the status of vaccination of the dogs, then again there is limited availability of anti-rabies and it's only in government. So with animal bites, of course, if it's simple scratch, as Dr. Jeffrey mentioned, you can always visit the clinic, see our specialists, and they will guide you. And if needed, of course, they will move you on and send you further down for the rabies injections. We have received a question right now, and the question is: what is the immediate first aid in case a heavy object falls on any part of the body till we reach the clinic? Dr. Kritika, I would like to interact with you on this question. So, if something fell on a person, the extent of injury he hasn't mentioned, so I can just assume something fell on the head, and the patient is at home now. What is the immediate first aid that can be done in these cases?
Okay. Good question. Imagine a person has a heavy object which fell on his head, and first thing we need to see if there's any injury on the head, if it's bleeding, and try to put a if at all it's bleeding, just put a pad on it and then cover it and press it for some time till the bleeding stops. There are various red flags to look on when depending on the part of the body, especially if you have an object which falls on the head. We need to look at things like level of consciousness, whether the person is talking normally or whether he's feeling drowsy, or if there's any internal bleeding. There might be bleeding through the ears or the nose, or the he might vomit blood sometimes, or the eyes can get red. All these things you definitely have to immediately shift him to the hospital. Sometimes the person might be dizzy and then talk normally and again become dizzy, and he might feel that he's normal. This is called the lucid interval, which we have to be very careful of in any head injury. Okay, imagine someone who's having a injury on the head, and then he's vomiting, and he's little nauseous and vomiting and altered sensorium, like his consciousness is not he's not talking properly. Definitely it is a red flag and you need to take him to the hospital. In fact, if you have a like imagine an object falls on the abdomen, there are various organs in the abdomen which can be damaged because abdomen is more soft tissue, and in that case again we need to rule out any internal bleeding. Like in any case, without taking any risk, if it's a very heavy object, you definitely have to take him to the hospital so that further scanning or any organ damage can be ruled out.
Thank you. In particular, Dr. Kritika, a person who presents with, or someone who calls you up, or they are just worried about someone bleeding from their nose. Is there anything specific that can be done to prevent nasal bleeds?
Yeah, nasal bleeds can be because of various causes. It's very common in this part of the world because of the dry weather and lack of humidity. Like, it's the commonest thing in children would be like a picking of the nostril, because the nose has a rich blood supply and it easily bleeds. So in such cases, a moisturizing lotion or something would be enough. But if someone is bleeding profusely and it's not stopping, as a first aider, we can just tell him to pinch his nostril just below the bony part, on the fleshy part of the nostril, bend forward and keep pressing for at least 15 to 20 minutes till the bleeding stops. Most of the time it would stop. If someone is there, you can just ask him to bring an ice pack and place on the nostril, because ice actually constricts the blood vessels and the blood would stop actually. The other reasons which are more sinister would be like high blood pressure, head injury, or injury to the face, facial bones. So we definitely have to ask whether he fell down somewhere, or whether he had an injury or some fight, or someone has knocked him on the head, and things like that. The other common reasons for bleeding through the nostril would be an allergic rhinitis or a sinusitis, in which they have big polyps inside, big swellings inside the nostril, which can bleed as well. So these are small things, but the main thing as a first aider would be to pinch the nostril just below the bony part and keep pressed for some time. Make the person bend down so that they don't swallow the blood which they bleed, and put ice pack on top of it. which is the commonest.
So Dr. Kritika, there is a common myth, which is known a lot of people. There is always a confusion with whether pinching the nose and bending forward or pinching the nose and moving your head backwards, because you see always different people acting differently. So what is, as a specialist, what is your advice to pinch?
I would recommend pinching the nostril and bending forward, because any blood which is collected behind the nose should not be swallowed. When someone swallows the blood, he might actually cough out, and that would increase the pressure in the nose and it would bleed further. And in addition, while pinching the nostril, the person should be asked to breathe through the mouth actually for at least 15 to 20 minutes. So
Great.
moving forward actually.
Thank you. One question here for Dr. Sabah. We have a question for you. Is there any classification of first aid based on intensity? I have no idea what the question means, but probably it says classification of first aid. I think what the person is trying to ask is the intensity or the urgency of cases. So they're trying to ask you, should you walk to the patient? Should you run to the patient? Which type of agents should you do those actions with?
Yes, I think intensity, we cannot, by just, if you're a bystander, I think for pain also, if we are doctors also, we cannot set the pain intensity for our patient. It's the patient itself who will tell us that I am 9 out of 10 and 5 out of 10. There is no scale up till now, discovered that we can say the intensity. But yes, first aid, actually, it's a context. We will see the first aid in many scenarios, how we have to respond. The main thing in the first aid is what we have to develop, that we have to do the preventive measures. We have to plan the programs that these things might come. For example, in any disaster context, any earthquakes are there, any floods are there, and all this is preparation. You should be prepared. And I'm sorry to say we are not prepared for anything. I work for the earthquake victims. I work for this one. We are not prepared for anything. Then second is when environmental context, water context, we are not prepared for it. We are not prepared what to do if, God forbid, any water disaster is there. We should, I think, educate our children to learn for the swimming, for the safeties, for the how to obey the laws and the red flags we have to see accordingly. Then it comes pandemic context. For example, in pandemic areas, we learn a lot from this pandemic. We learn how to behave in the pandemic. Before that, we doesn't know about it. Then come into the remote access. For example, we are not in an urban area. We don't have any clinical facility around. In that scenarios, we should know what is the point we have to do. This is the remote context we have to follow. And then if it comes, for example, the normal first aid, so basic thing is your CPR setting. I think every person should know the CPR, what to do at that case. And second thing, we know how to assess the patient. That is called the primary survey and secondary survey. What is the primary survey? ABC, airway, breathing, circulation. So these things only look into the patient. You can see the chest is moving or not. Just put the hand in front of the nostril and see if some air is coming or not. This is, anybody can this one, if they cannot check the pulse and anything. You can at least call the ambulance. So second point is prevention, planning. Then you have to preparedness, and then what you have to do is that access. You have to give the first aid and got the access. And third thing is the recovery phase, how the patient is recovering. It might be with medical assistance, it might without medical assistance. So these basic concepts, I think we have to improve it. From, I think, for the very childhood levels, we have to increase this one. And WHO also recommends we can do it gamification. We can start making the games, the videos in that sort of, that our children will learn how to respond, how our reaction should be at that time.
Great. So I think what you said is absolutely true. The lack of awareness, and people are not trained enough to attend these sort of emergencies in pre-hospital setting, and which is why we are having these webinars. And we're so grateful for all the three of you that today you've come and you've given your expert opinions. It has cleared a lot of dust. We have learned a lot of things, and this is one of the reasons why we put you all of you on this show today. So I would like to request all the viewers that we have people working in Prime Healthcare Group. We have specialists. These are primary care physicians. They are family physicians. They will take care of you. They will guide you. These are educators. They are clinicians, and they take care of you like a family and of your family. So again, I request all of you, all our doctors are available in branches in Lambda, in Berjuman, in Jumeirah. All the three are accessible. All these doctors are very friendly. As you've noticed, they are very knowledgeable. Thank you for that answer. I have a question for Dr. Jeffrey. Not very common, Dr. Jeffrey, in this part of the world, or perhaps we don't get to see them because we have moved to a city with a lot of construction in place. But there are people in the extremities or peripheral areas. There's a question about snake bite, Dr. Jeffrey. What would be the first aid in those cases?
Well, that also depends on the area that you are in. So most of the times, a good majority of the snakes are usually non-venomous. But having said that, there is a percentage of venomous snakes too. So unless you are into reptiles and snakes, I don't think most of us can identify a snake, whether it's non-venomous or venomous. Having said that, if there is a bite, particularly by a snake, I think the first thing to do is to tourniquet the area. Okay, clean the area with soap and water, tourniquet the area, and not as tight as possible. Now, you used to watch movies, you can see them actually trying to suck out the venom and things like that. Do not try to do any of those. Just wash it with soap and water, tourniquet the area, and go to your nearest hospital. Right, that would be the best thing to take for a person that is actually conscious. But if you find an unconscious victim there, you think that it's a possible there's a puncture mark on the wound, on the leg or on the hand, then as soon as possible rush the patient to the hospital, because there's nothing a layman can be doing at that point of time. It has to be done at an emergency setup, and we need to give antitoxins to the patient so that to get the patient revived.
100%, 100%. I just remembered something that you mentioned, Dr. Jeffrey, how to identify snakes. What I recall back from my days was red on black, friend of Jack, red on yellow, dirty fellow. So if you see a snake, we have these colorful snakes. So if you see them in those, they have these stripes, and if the red and the black are together, so we have red, black, and then white and yellow. So red on black is friend of Jack. These are non-venomous. Red on yellow, dirty fellow, definitely venomous.
Yes.
So yes, thank you. And one more thing I remembered was the scales. We were told by consultants that between the nasal flares and the eyes, this is just a tip. This is just out of context. But since Dr. Jeffrey brought this out, maybe I thought I'll put this in. If you have more than 3 scales between the eye and the nostrils, these are non-venomous. And between the eye and the nostril, the nasal flares of the snake, if you have less than 3, then they are venomous. Again, this is probably some myth, some experiences, but I thought I'll just throw it out there. Question, Dr. Kritika, I have a question for you about burns. What are the common types of burns in household, and what is the immediate care of these patients?
Okay, good question. Okay, I would just imagine someone is cooking and some oil has spilled on the forearm. So what has to be done immediately? Just run to the tap and just have some water like pouring on it for at least 20 minutes, 15 to 20 minutes at least. So that actually plain water actually cools the area and decreases further tissue damage. After that, just if you have a pad, just put the pad on top of it and just tie a gauze bandage around it and go to the hospital. If there are blisters on the burns, like don't try to break the blisters because it would delay healing later on. There's another question here. I could see acid burns. What first aid should be given in the patient in case of acid burns? Actually, I believe that milk has to be sprayed on acid burns. any burn, whether it is thermal or chemical. There are different types of burns, basically acid burns, chemical burns, which are called acid burns as well. If there's anything, you just have to wash it. There's nothing like you need to spray something on it. Whatever the burn type would be, first to remove the substance which is causing the burn. Actually, if it's heat, then that has to be removed. If it's a chemical or an acid, that has to be washed off. When you wash acid burns, be careful not to injure the other parts of the skin with the acid. Like you have to wash in a way that it doesn't spill on the other parts of your body. So that's very important. Fresh milk is an alternative. If you don't have a source of fresh tap water, probably you can use fresh milk. There's nothing wrong with that. But reach the hospital so that any food item is cleaned properly, and then they would just put a cling film on top of it, like a hydrocolloid gel, which is non-sticky. And one more thing I would tell is to avoid putting any bandages over burns which are sticky, because we find it very difficult when you come to the hospital to remove the bandage, which removes this soft skin under it as well. So just put a cling and just loose gauze around it and just walk to the hospital for the burns.
So you recommend we can wash it with normal tap water as well? We don't need to look for special sterile solutions or salines. We can just use regular tap water and just wash it off?
Yes. Yeah. There's don't need any. If at all you don't have a source of water, then I would recommend you can pour any other. But when you apply antiseptic, it actually burns you and it delays healing as well. So it's best not to avoid putting turmeric. It's better to avoid putting turmeric or toothpaste or something, which will again increase the burn, and it will be
that was my next question to you. We see most of the time patients applying toothpaste for burns, regular burns. So you said no, you don't recommend that, right? It's just probably a myth. It is not scientifically proven.
Yes.
Great, thank you very much for that answer. Dr. Sabah, I have a question for you. We have a viewer who's asked us what to do a condition if patient has heat stroke or unconscious. Should he just come to ER?
Yes. In these conditions, like for example, if the patient is unconscious, and it depends on the scenario where you are, it's outside or you are near to the clinics, or how you approach the patient, just see for the initial assessment of the patient. If patient is fully unresponsive, call the ambulance. First thing what you do is to call the ambulance for help, because nobody can give the complete help to the patient. Second thing, you can see and assess the patient how it is. It can be either a heat stroke, it can be only a heat pyrexia, so heat exhaustion always, because in this climatic area, sometimes it goes up to the 50% or more. The humidity also is one of the factors. So just loosen the clothing, at least if the patient is breathing, a bit response is there. Try to hydrate the patient, do light clothing, try to pour some water into it so that the body temperature will come down, especially on the heat areas. Okay, don't the bystanders just it will, because normally what people are doing, crowding the patient, and it can cause the patient more, he can stress out more. So better, if the patient is a bit better, you can bring the patient to the hospitals or the nearby clinics, because main thing, we have to give hydration to the patient so that heats will come down. We can provide the patient to some cool temperature, or if you can see nearby also some AC temperature or something is there, you can go to the shade areas and provide hydration to the patient.
One last question from you, and then we can probably wind up. The question is continuing. It's about the heat exhaustion. Dr. Jeffrey, what is the best way to prevent such incidents? I mean, now we're moving to a little more further before the event has happened, but is there any specific drinks or types of substances that they should be taking, especially in this part of the world where it's really hot and working in 45 temperature?
Yes. So in order to prevent a heat stroke or a heat exhaustion, well, the first thing is try not to be too active during those extreme hot times. For example, if it's in the afternoons, try doing your exercises in the afternoons, or getting into a gym that's completely closed. And most of our buildings and apartments have gyms which are usually closed. And try not to exercise. Walk into those rooms which are extremely hot and start exercising once before even the room temperature sets in. So try not to be too active and take breaks when you take an exercise. The second thing is you can drink enough fluids, okay, like water. Sports drinks are also recommended, like, that contains a lot of sodium and potassium, a lot of electrolytes. So that's absolutely fine. One of the things that when we talk to patients, they say that, I wasn't thirsty, so I didn't drink water. So that's one of the symptoms that you need to recognize, that it's not the lack of thirst. You might not feel thirsty, but try to take small sips when you do exercises. Don't force yourself with very large amounts of water. All right. So exercising can be done probably earlier in the day, or when it's a little cooler, or probably a little late in the evenings. Like how Dr. Sabah said, you should try wearing loose clothing, light-fitting clothes, and not too many layers. Don't wear a jacket when you're going for a run and things like that. Avoid sitting in a hot car. Now, some of the things that you can do in order to prevent, one of the important things in fluids that you need to remember is try not to take any kind of caffeinated drinks, because that also increases the exhaustion. Alcohol increases the exhaustion because it dehydrates you again. So these are things that you could do.
Very well. Dr. Jeffrey, just one last point, and then we can just wind up. People say that you can lose more weight when you exercise while it's more hot outside.
Well, the common misconception is that, yes, you will lose weight. Obviously, when you are dehydrated, you're going to lose more weight. But it's just dehydration. So the moment you rehydrate yourself with fluids, you're definitely going to gain back that weight. And that's not an actual weight loss. That's just dehydrating yourself. And that is not a good thing to do.
That is exactly why I asked you this question, because I knew as an expert, this is exactly what you will tell our viewers. So again, it's not actual weight loss. It's the lack of water, which you refill again, and it doesn't make any sense. So as Dr. Jeffrey said, please be in indoor spaces. Try not to be exposed to the sun unless it is really required. Again, to all the viewers, all our panelists today are available at our clinics. Dr. Sabah Khalid is available in Nahda branch. Dr. Jeffrey is in Jumeirah branch. Dr. Kritika is in Burjuman branch. So again, these are jack of all trades. I call you guys jack of all trades because primary care physicians and family medicine is very. This is an art by itself, and there's no one that can do it better than all of you. Thank you for joining us on this show today, and it was very, very helpful. I'm sure we have a lot of take-home messages, and all the viewers, our numbers will be displayed if you would like to book an appointment with these doctors or on our mobile applications. And these are not just clinicians, but they are educators as well. So I am sure once you build a rapport, these doctors will have a good impact on your life and help you along your illnesses. Thank you once again, all of you. Thank you, Dr. Sabah Khalid, Dr. Jeffrey Zakaria, and Dr. Kritika Rani for being on this show today. And hopefully we'll have you again on these shows and probably some other topics. And we look forward to hearing from you on those occasions.
Thank you, Doctor.
Thank you, Doctor.